Hello guys, and welcome to the third episode of No Strings Attached Show, and this episode featured Dr. Dominique Harmath. Dr. Harmath is an evidence-based chiropractor, and she's super passionate about the work that she's doing, very knowledgeable, spends a lot of free time researching and continuing to learn. She won multiple international awards for the work that she's doing. Former professional tennis player, she's a four-time Canadian national champion and top 50 Division I NCAA. She attended Rice University. I had so much fun talking to her. We talked about injury prevention, managing training loads, some recovery techniques. One more thing I'm going to add. If you want a free 15-minute assessment from Dr. Harmath herself, or if you have additional questions to her, you can DM her on Instagram at thesportstherapist, or you can email her at dr.harmath@esmclinics.com. If you guys want to do that, make sure to use the code NSAShow. Without further ado, guys, let's jump right into it. So what you've been up to lately?
Well, I'm a chiropractor at Exercise Sports Movement Clinics at Yonge and St. Clair, so working in clinic, and I am also doing the Sports Sciences residency program right now to specialize in sports chiropractic, so busy. That's basically all I'm up to, and when I get the chance to actually chill, I take it.
Okay, that sounds good. Every time I'm on Instagram, and most of the people I just block. I mute them. I hate those stories. Like, it's just such a waste of time. But you're one of the few people that actually keep those stories to look, because you're constantly like updating us. Like, I'm like, it's usually during the weekend, right? So like, I'm at this Taekwondo tournament. I'm at the ITF tennis ITF. I'm like, how many sports do you cover as part of your profession?
So I do cover a lot of tennis. So with the ITF, I'll usually be working the junior events. And then on top of that, I'll work some soccer through the Ontario Soccer League and the Taekwondo Ontario events as well. Those are, I'd say, the primaries right now. And then we'll see in the future as well where it all takes me. But so far, those are the mains,
Okay. So being obviously a tennis player in the past, quite pretty good one, I would say. It makes things easier for you in terms of identifying injuries and when talking to players. So I would assume, correct me if I'm wrong, but it makes things a little bit easier. When you go to an event like Taekwondo or soccer, where biomechanics are a little bit different, how do you find, do you find any challenges when you work with athletes? I'm just trying to draw parallels, for example, with fitness coaches, where they come from different sport. They their background sport was, for example, athletics or basketball, and then they come into tennis, and they kind of struggle sometimes to understand like what are the movement. Of course, they learn quick, and as they work with along some fitness coaches from tennis. But I was just trying to understand, does it work the same way in your career, in your profession?
Yes, okay, definitely. So regarding the Ontario soccer and Taekwondo, we're mostly medics on site. From a treatment perspective, 100% tennis gives me a huge advantage.
That's right.
Because I was an athlete. I'd like to think I still am, but definitely not competing in tennis anymore at that level. But the understanding of the biomechanics of tennis and exactly how all those injuries feel, and what I know how I had it treated, how I want it treated, and the rehab I want for it. It definitely gives me an edge with that sport versus, soccer and Taekwondo. Well, didn't play competitively either. Didn't do Taekwondo at all. So, I'd say those that were previous athletes in the sport definitely have an edge from the chiropractic or physio standpoint.
Okay. And what are the ages of those events that you attend, age of the players?
They're all juniors.
Okay.
Yeah.
From
I'd say for soccer, it would range from about 13 to 17, 18. And for Taekwondo, actually we have juniors as well, again, ranging from, they're all in separate age groups, so 10 to whatever, and then all the way up to age 18 as well. And then you have your seniors actually for Taekwondo as well, so that's not only juniors.
Okay.
So then we're at those events and tuning,
Okay. And what are if we have to talk about more specifically about tennis, do you see any common injuries among juniors? like anything that you like noticing like over and over, and it's like, oh, again, this rotator cuff, or like, oh, like this thing, or oh.
Yeah, definitely. So regarding my personal experience, I most often see back, shoulder, abdominal, and either hamstring, glute injuries, which is funny because that actually matches up with what the current literature is also saying on the most common injuries in tennis regarding elite junior players, where they're saying back pain, lower back pain, specifically the lumbar spine, is the most common area to get injured in juniors, and the shoulder as well. So those are definitely the top two, and then that is followed by hip, groin, and abdominal injuries. But again, the literature really varies just because it's so difficult to study. Common injuries have to be categorized by age and level of tennis play. So you'll have your junior players, who at an elite level, you'll have your former collegiate players that either went professional or are playing professionally, and then you'll have your older age group that are now just playing for fun, and then you have your recreational players that they're from a biomechanical standpoint maybe
That's right.
Not the most ideal from an injury prevention perspective, and each of those categories will have different types of injuries. So like I mentioned, for elite juniors between the ages of about 13 to 18 to 20, you'll have that lower back predominantly, followed by that shoulder, hip, and groin. And then when you enter professional tennis, that back injury and shoulder actually stays the same. But then you have a category of chronic injuries and acute injuries. And again, it's a little heterogeneous in the literature regarding, well, what is the definition of a chronic injury versus an acute? And usually there's a lot of ambiguities within these studies. But in general, what systematic reviews have found is that for acute injuries, it's most often the lower extremities, for example, ankle sprains. And for your overuse injuries, that's usually the upper extremity, consisting of shoulder and elbow. And then you have your older tennis players that most often the degenerative kind of conditions come on, osteoarthritis of the knee, hip, etc. And then as well lateral epicondylitis for the older age group if their technique is a little different than what is currently taught with their grip and motions specifically. And that lateral epicondylitis, again, continues on to the recreational players as well, where their biomechanics just simply puts more stress through that lateral epicondyle, which is the outside portion of the elbow, also known as tennis elbow. So that's, I guess, the general summary of most common injuries. But again, the literature really varies just because it's very complex and difficult to study.
No, of course, I have no idea how you can actually like do a research on that, because it's such a complex thing to do, like to structure that data and to organize it, and to it's just blows my mind like what people do, and then, like, huge respect to them, honestly.
Yeah.
But what you mentioned is actually pretty interesting. Amongst one group, based on their technique, the injury might vary. Is that, did I understood that
Yes.
correctly? Okay, can you talk about maybe you give some example, or have you encountered that in your experience where, because of the bad technique, maybe more so in the kids, in like juniors and maybe younger professionals, because of the bad technique, they would have to see you, and you would have to maybe contact the coach and say, hey, maybe or you should look into that because this is what it's causing.
Yeah. Well, a good example of that is wrist injuries, for example. So wrist injuries are known to increase from the age of 13 to 18 in juniors. And we know you have your continental grip, your semi-Western grip, your Western grip, and your Eastern grip. And it's been found that players with either semi-Western or Western grip have increasing injuries of the, it's called the triangular radial cartilage, TFCC. And that, again, is most often injured when you have a semi-Western to Western grip. And then you'll have more of a tenosynovitis on the outside portion of that wrist.
What's that? Sorry, just
it's an aggravation of the tendons, specifically the extensors, and again, that tendon becomes inflamed from constant aggravation from the eastern grip. Now we're going to the other spectrum. So you have one spectrum where you have irritation of the tendons, and then on the other spectrum with the semi-western and the western grip, you have aggravation of the other side of the wrist called the ulnar side of the wrist, where there's a fibrocartilage in between the two bones that also has limited blood supply deep inside that area. So again, it's most often injured with those grips. That doesn't mean that if you have that grip, it's going to be injured. There's just more of a prevalence of injury with that.
Just to clarify, when you're saying semi-western, western, so starting from semi-western and further, or like including semi-western? Including
semi-western,
okay.
Yeah. And of course, the extreme amount of load through that ulnar-sided through the ulnar side of the wrist will be your western, right? Because that's
that's
like
right.
that.
That's right.
So yeah, probably less with semi-western. I don't know what the statistics are between the two grips, but it'll increase from semi-western to western. But again, just because you have that grip doesn't mean you're going to get that injury. It's just a trend that they've seen.
Yeah, it's interesting too because it's, I mean, in tennis, you know, like yourself, like it's one of the red flags to have that Western grip with kids. Not only, I mean, mainly we talk about tactical, you know, a disadvantage for having that because you won't be able to hit as much through the court. But it's interesting to hear that it's actually like you might increase the risk of injury if you maintain that. That's pretty interesting. Anything other than that that you encounter?
Yeah, you also have, for example, the kick serve. So the kick serve has been found to put the most load through the lower back. And correct me if I'm wrong, the kick serve is normally taught to juniors between the ages of 13 to 15 approximately.
It depends. I mean, it depends honestly, like on the coach. Like I know some coaches prefer to keep the slice till like 12 till 13, like you're saying. Some coaches would start to do it as young as 11 and 12. Like medically, again, I'm not educated enough to say what's good, what's not, but I would say 12 is a good age to start. 12, 13, like maybe 13 is a little bit late, but just to develop the hand, because it's all about, you know, like to have a feel like with which way the hand is going, and just to develop that skill early on. But sorry, go ahead.
No, definitely. I mean, it's good to know as well from a coaching perspective at what point ideally you'd want your players to start throwing in another type of serve, because of course that's going to enhance performance and hopefully add to their results. The other thing to consider though is that these kids are still growing, and the kick serve puts the most force through that lower back, and with lower back injuries being the most common in elite juniors.
More than the first serve, more than the slice,
more than the slice and more than the flat.
Okay.
Yeah, and just for this reason, it's just caution to maybe have some kind of exercise program prior to introducing the kick serve to make sure that whole area is already used to that load at least prior to introducing it, because you also don't want to shock that system, because of course you're serving what on average of about 90 serves per match. That's just per match, we're not even counting the amount of training and the baskets you're serving. And that young age, again, the bones are still immature and the kid is still growing, so it's important to just have that in the back of your mind as you're taking these players through, because that's always like the fine balance between, you have growing kids who are playing junior tennis, but at the same time you want to balance how much load you're taking them through, but also pushing them so obviously they reach the performance goals. So there's just a couple things to consider from that perspective.
That's right. That's so fascinating. How would you know like this is the right load, and this is, because I mean it's not something you can put a number on really. It's just more like something the person feels, or that constant feedback, coach player communication, player parent communication. Any other ways you can manage that, you can measure that?
So yeah, load management is quite complex, and again, so the definition of load in sports medicine is the sport and non-sport burden of a stimulus placed on a human biological system. So that includes anywhere from physical load regarding any of the extrinsic whatever movement that you might have, but then that load is placed not just on the individual itself, but on the tissues, the organs, and the cell structures as well. So that's just the definition, and then you get into, okay, how are we going to manage the load? Now we're getting really complex because there's so many different areas to it. Like I mentioned, you have your physical stuff, which is like volume, intensity, competition schedule, training schedule, and then you also have your psychological aspect as well, which is, like you mentioned, the feedback back and forth between coach and player. How are you feeling today? Are you fatigued?
That's right.
What's your energy level like? How is school? How much are you sleeping? Are you stressed with exams? These are all important things that should be considered within that training program. And where to start? So let's start with chronic load ratio. So chronic load ratio, you're looking at what is that player's usual training schedule over a period of time. So if you have a player, let's say from Tennis Canada where you're at, and that player obviously has a very intense training schedule followed by a competition schedule, they're going to be used to a lot of hours of training, which is good. You want them to be able to take all that load you're putting them through hours of training, maybe 2 to 3 hours a day, 6 times a week, something like that.
Depending on the age, like I don't know if I don't know like exact numbers of LTAD, like in terms of the age, but for 12 you're looking at about like 12 hours, 12 to 14 hours a week of tennis, and then 13, 14 you increase to like gradually 18, 20 hours.
Got it. And yeah, that's a good way of doing it, gradual, like you mentioned. Shocking the system is never fun for either party. So yeah, number one, getting them on a routine schedule that they're used to, and again, getting their feedback the whole time of how they're feeling as well. But then, of course, we know that, well, as they get older and as they get better, the training is also going to have to increase, and the tournament schedule is going to increase as well. And then according to the Olympic Committee statement in 2016, they had mentioned don't increase training levels more than 10% per week. This isn't a fact, it's just a general suggestion because, again, every individual varies, and again, you want to specialize it to that person or
That's
that
right.
Player in front of you. So if you're going week to week, you can slowly increase that training load regarding measuring it. You could do complex acute to chronic load ratios, but again, that gets a little bit complicated. But in general, listening to your athlete and how they're feeling, and asking them where they're coming from too. So you usually get new recruits as well. So instead of taking new recruits and throwing them into a super intense training program, asking a little bit what they're used to and then working them up to what is expected is a good idea to manage load like that. And then some other perspectives too. You have your volume, intensity, and then of course recovery. So the summary, I guess, is if you're going to be pushing them through high intensity, high volume training, prepping for a competition, let's say, so you'll have 2 weeks of high volume, high intensity, then you have to make sure that you're giving that athlete adequate time to recover in the taper down period prior to that competition so their body can recover. That's the gist of the load aspect to it. And then you have the nutritional and sleep as well. So already athletes that get minimum 8 hours of sleep are going to be feeling much better and have less injury risk than those athletes that are sleeping less than 8 hours. So again, very important to emphasize to the athletes to sleep at least 8 to 10 hours to decrease that risk.
Speaking about sleep, have you listened to Matthew Walker or read his book about sleep?
No.
He was just saying something that you touched on, and basically if you sleep less than 6 or 8 hours, he was saying your muscle, like they're stabilizing, how are they called, like
muscle stabilizers?
Sure, yes, okay. Those. So they start to fail. So if you do like for example balance on a Bosu ball, like you will have less ability to maintain your balance if you sleep less. So they start to fail, and of course if they start to fail, you have more risk of injury, which is interesting with something that you're kind of saying, like the less sleep you get, the more chances of injury.
Yeah, I'm not familiar with that author, but regarding that statistic was specific to tennis players and junior tennis players. So again, the amount of sleep will also vary depending on, again, what age group we're talking about and the level of exercise or sport that athlete is going through. But specifically for junior tennis players, in one study that was cited was for junior tennis players to have at least 8 to 10 hours of sleep to decrease that injury risk.
Okay. Can you talk a little bit more about recovery? Because I think this is like one of the most I don't know, like we're not talking enough about recovery, and we're not doing enough recovery with our athletes, in my opinion. Like looking how hard we train and how much they go through, I think like it's so important. And like you cannot, like I think I heard this expression somewhere that there is no such thing as too much training, there's just not enough recovery. So can you talk a little bit more, what can we do better as tennis players, as athletes to recover better?
Sure. So recovery, there are many forms of recovery. There's just recovery from general exercise that you're used to, and then unaccustomed exercise. Let's speak towards unaccustomed exercise, where you get delayed onset muscle soreness, which is what tennis players most often experience when, let's say, they make it all the way to the semis or the finals of a tournament, and then they're really feeling the muscle soreness. So from that perspective, there are a couple different strategies you can use. So currently in the literature that is really being talked about right now, you have ice therapy or ice baths. You have compression garments or compression sleeves. Does it really work,
like the ice bath, or is it more placebo effect?
Okay, so I'll get straight into it.
Yeah, I've heard different things. That's why I'm asking. I'm like...
So regarding ice bathing for recovery on delayed onset muscle soreness, there is actually evidence supporting ice baths or simply icing areas after intense unaccustomed exercise. And they've generally found that if you're icing between 11 to 15 minutes at a temperature of 15 degrees Celsius, that is actually going to reduce muscle soreness. Now, the key is if you have a singles match and a doubles match, and you just had a crazy singles match and you need to recover for that doubles match, then icing is an option. The key, though, is, however, to give that athlete or yourself enough time to do a warm-up to counteract the stiffening effects of ice prior to hopping on the court. So if you're icing 11 to 15 minutes to reduce muscle soreness, then you're going to want to give yourself about 15 minutes to get that warm-up going again, so so you're ready to go for the match.
Okay, what about cold shower?
I'm not sure what the evidence is on cold showers, but if you can get it to 15 degrees Celsius, then maybe. But again, that's, well, I don't know. I'm not sure what the evidence is on that.
Just that a question popped up in my head.
Yeah,
so,
I mean, maybe it's similar. You can try it and see what it's like.
Okay. I'll let you know.
Okay.
Next time I play my match, I'll...
Sounds good.
Yeah.
And then after ice bath, you have compression garments, you have sports massage, you have active recovery, you have stretching, you have foam rolling. So a lot of different areas here. I'll get to, I guess we can start with compression garments.
Yes, please, because that was my first question. Like, how does that work?
Awesome. So again, many different forms of compression. You have compression sleeves that you often see athletes wearing during their matches. And then you also have compression systems where you have an entire contraption on your either legs or your arms that has a peristaltic type of compression. So it'll start compressing. Let's say if you put it on your lower extremity on your legs. Some examples are like the Normatec systems, etc., that have these contraptions. And the compression starts in your legs, and then the next next contraption starts, and then it compresses your calves, and it works its way up. And again, so the evidence behind that and the compression garments, I'm actually going to speak more towards the compression garments because the research isn't really quite there with the new evolving compression contraptions that I recently mentioned. So compression garments, the research on that is heterogeneous, which means it's kind of varied and not very consistent, but the evidence is supporting compression garments at the moment in reducing muscle soreness. But the results are to be interpreted with a little bit of caution because, again, there was quite some variability in the current literature right now. So future studies will still have to investigate how effective compression garments are. But so far at the moment, they're saying that
how does that work? Like, what's the principle behind that?
So for compression garments, the idea is to increase blood flow and to keep that blood moving. As well, it gives that skin stimulus as well by compressing the skin. So the exact mechanism isn't exactly known, but that's the general idea behind it. Okay. And from that, it reduces muscle soreness.
It's interesting because it's actually like holding the muscle tight. So you would think it would prevent the blood to flow, no? But it's the opposite.
Well, again, it depends. If we're talking about the contraptions, then it's peristaltic. So then I guess it's a little more similar to sports massage, where you're massaging the blood towards the heart. And then for the compression garments, maybe from that perspective, it's more of a muscle stimulus perspective. But again, mechanism isn't quite known, but many athletes seem to be happy with it. But again, it's the literature. We're also looking at whether it works or not. It seems like the results are positive, but again, interpret with caution because, again, we're not completely sure.
Okay. What about sauna for recovery? Now, I'm not talking between matches, between singles and doubles match, but like in general, what's your take on sauna?
I'm not sure. I haven't read up on the evidence on saunas, and it's not really talked about right now in the literature, so I can't comment on it. But we have sports massage, if you want to discuss that.
Sure, for sure.
And
the reason why I asked about it, because when I was a kid growing up in Eastern Europe, we really had this sauna idea, and every time after like Saturday practice, we would go to sauna, jump in the snow, that type of thing. So like contrast like with temperature. Like my parents told me like, oh, like it's good for you, like for your recovery. And I was like, all right, I guess it's good for me. And it felt good. But again, I don't know, is there scientific evidence of that? So that's what I was asking.
So from that perspective, you could try to compare sauna and ice bathing, for example, and contrast therapy, jumping from one to the other. The evidence for that also showed that they didn't specifically use saunas. They used 2 ice baths, a cold bath and a hot bath, and then they contrast therapy. You jump from one into the other. And from there, it also showed that it decreased muscle soreness, but not to the extent of just ice bathing. That's what the evidence was saying. And then you have your others like sports massage, active recovery, stretching. So do you want to discuss all of them, or do you want to pick a couple? Or?
I mean, let's go through all of them. Sure. We have time. I'm just gonna throw away my phone because somebody keeps texting me. Not anymore.
So sports massage. So sports massage was actually found to be the most effective in the literature in reducing muscle soreness. So if you have a sports massage therapist on site, or even if you have someone, actually I took sports massage courses as well, so it's something to offer when you're on site with athletes, whether it's at an ITF or whatever that individual might be working at. And then you have active recovery as well. So active recovery is a little interesting.
Before we get into that,
sure.
Can we talk a little bit more about the massage? Because I have already a couple of questions.
Okay, go for it.
How often do you recommend high performance, let's say junior, between 13 to 17, 18, I don't know the exact numbers. Maybe you correct me if the range is appropriate. But how often should it be done? Once a week, twice a week, and during the competition, how smart is it to make it happen every day, every other day, only after long matches? Just if you can talk a little bit more like about the timing and frequency of that?
Sure. So this is all in regards to unaccustomed exercise. So really anytime that athlete is going through unaccustomed exercise where they're going to get delayed onset muscle soreness, also known as DOMS, then sports massage is an option. So there's no, to my knowledge, there's no amount that is too much or too little. If you're going through unaccustomed exercise and you're going to get delayed onset muscle soreness, or you already have delayed onset muscle soreness, then sports massage is a good idea. You want it within 2 hours after that unaccustomed exercise.
Okay.
I'd say for about 20 to 30 minutes.
Why?
That's just what the evidence is.
Okay, because
saying.
the recovery is better, or?
I'm not sure. It's just what has been cited in the literature.
Okay.
But regarding the physiological basis, same thing, improving that blood flow and getting oxygen in that area to allow the tissues to recover a little bit faster.
Okay, interesting.
Mm-hmm.
Sounds good.
Okay.
Yes.
So active recovery?
Yeah.
All right. So for active recovery, you have to consider fatigue at this point. So active recovery has been shown to be good short term. So again, let's go back to our typical tennis tournament. You have your singles and your doubles. If you complete a really tough, like 3-set singles match, and you have doubles in an hour, then you definitely, if active recovery is what you choose as your recovery, then you definitely want that to be like a really light jog, because you don't want to fatigue yourself more than you already have from that singles match. So caution with active recovery there. If you have time and you maybe don't have doubles, then a more intense or faster jog maybe is an option, or aqua jogging if you really have all that. Yeah. All those resources around you. But for simplicity purposes, a light jog will likely do after a match. And any questions on active recovery?
Let's say a player has a singles match. I would say like 2 hours, maybe not like the intensity that you were describing, 3 hours, but 2 hours match. Doesn't have a doubles match, and I take that player for a practice, for like a 30-minute practice. Does that work as active recovery or no?
When is their next match if you're training
Tomorrow.
with them? At what time?
Let's say 10 o'clock.
Okay. So at that point, it comes back to load as well. So how many matches did they have previous? If this was their first match of the tournament and it was 2 hours and it was nowhere near what their usual training schedule is. For example, if their training is 3 hours a day and they just had a 2 hour match, but it really didn't push them, then yeah, sure, hit the court. Again, ask them as well, how are you feeling? How's your energy? Are you fatigued? Did you sleep enough the night before? Any other stressors that I should know of. And then if all is good, then yeah, hit the court for that next session. If we're at the semifinals though, let's say, then maybe some reconsideration there, and then really getting the athlete's feedback at that point. Like if they want to groove their strokes for their next match because they really didn't feel good about that singles match.
That's what I meant. I didn't mean like take them to train, like as in like let's do Spanish drills, for like a next hour, but more just to maybe light grooving, hit a little bit, but it's still like it's just intensity of a light jog kind of, so that's why I was asking, does that count as active recovery, or do we do after?
Yeah, sure, that could be another form of active recovery. Again, it's called intrinsic feedback, so what that athlete is telling you, and if they really wanted to groove their strokes and it's not really taxing on them, then sure, that can count as some active recovery for the next day. Again, it's always individualized. There's no set fact or rule for how to do it. It's always going to be different from player to player.
Okay. Sounds good. We can move to the last one. Was that the last one?
So we have
foam rolling stretching.
So stretching, that is a really fun topic. So regarding stretching, if you're putting stretching into the perspective of delayed onset muscle soreness, stretching is actually not a good idea and should not be done. Stretching actually increases the amount of muscle damage happening if you're stretching after unaccustomed exercise. So that's not to say completely scrap stretching from every kind of routine you have. It means just after unaccustomed exercise, stretching should not be done. If it's accustomed exercise...
I have a question just before we can... I know you can talk about these things forever. That's why I'm kind of trying to jump in with my questions. Yes. So can you define unaccustomed activity for tennis players? Like, what does that mean? Because not every day is the same, and I'm just wondering, like, just can you be a little bit more specific when it comes to tennis players, just so I understand a little bit more, and listeners
Sure.
back home.
So let's give an example. So let's say the usual tennis training schedule is 2 hours a day, followed by 1 hour of fitness afterwards. And that's their accustomed exercise. They're used to it. You'll start with mini tennis, you'll go back, you'll warm up. By the time you're done with the warm up, it's been 20 to 30 minutes if you're including serves. And then you'll get into maybe some drilling. Let's just do cross courts, and then maybe you do a figure 8 drill. And then maybe some match play at the end. And then an unaccustomed exercise, if I'm giving an example, could be a day where you're committing practice to solely matches, and fitness afterwards is just sprints.
Okay.
At that point, now you're really pushing your athlete. Their heart rate and VO2 max are probably much higher than it usually is. That's actually a good way to measure how much more you're pushing them. If you can measure heart rate of what they usually are in a regular training schedule versus when it's unaccustomed exercise. But if an athlete gets delayed onset muscle soreness after an activity, that's a very easy way of knowing whether they've gone through unaccustomed exercise or not. But again, just knowing what you're usually putting them through, and then if you're adding more running drills or longer periods of hitting without a drink break, for example, just to really push them, then these are examples of unaccustomed exercise. And again, if they get that muscle soreness afterwards, that's your body's way of telling you, hey, we overdid it a little bit. I need some recovery. And again, that's not a bad thing. I mean, that's also how you push a player to get better and to be able to take higher loads in competition. It's the balance that's important. So if the body's saying, I'm sore, I need to recover, then listen.
Don't stretch.
Yeah. One, don't stretch. Yeah. And do something to recover. And then after that, the body will adapt. And next time you have that same training session, that player will actually be able to take it much better, and it might not be considered unaccustomed exercise anymore because they've adapted to that training load. So that's the fascinating part of progressing these athletes through their training program as they're getting older.
That's interesting. I never knew about this, like, non-stretching fact when you're sore. That's actually pretty cool.
Yeah, and not to say stretching isn't good. I mean,
of course,
if your goal is to increase flexibility, then yes, you're stretching. Or if your goal is to really warm up prior to a match, then dynamic stretching is an option. So there are still positives to it. Just in this context of delayed onset muscle soreness, not a good idea.
So when that happens, when you're not stretching, you would do foam rolling. Like, that would be your way of recovering?
For example, that's one way. Okay. So foam rolling, regarding the evidence, again, there are some heterogeneities in the studies with some variability. However, in general, it was found that foam rolling did decrease muscle soreness. So it is another option for muscle recovery. Just to note, if you are foam rolling and you're already really sore, maybe don't press so hard with the foam roller. Again, you don't want to induce more muscle damage. But if it's just your body weight that you're using and you're not adding any extra weight while you're foam rolling, then that should be okay. But again, you as the athlete know what your limits are and how far you can push yourself. So again, listen to your body as you're going through that.
So when you're sore and you're putting more pressure, it's damaging
not
the tissue,
necessarily,
or like the...
So in the stretching context, yes. Regarding foam rolling, I'm just advising that
okay.
Foam rolling is a good idea. Studies have found that it decreases muscle soreness. However, knowing that stretching induces a little bit more muscle damage, then the same thing goes with foam rolling. Again, it's a different mechanism, but you don't want to like really force that muscle through a lot of pressure because, again, you don't want to induce more damage. But if it's just your body weight and you're doing your regular foam rolling, then go for it. Also, if you're pressing really hard, you have a ton of bursa that you can irritate as well, especially on the side of the hip. So a little bit of anatomy tip there too. Just start light and then see what you can take.
Okay. Any recommendation in terms of like how many hours per session a tennis player should have, or how many days a week they should train, how many hours a day, and also hours per session, like I mentioned before? Any recommendations from medical standpoint?
So there's no one way of doing it. It's always going to depend again on who you have in front of you and what their previous history of what the chronic load ratio is. So where are they at? What are their goals? And then work from there. So regarding a number of hours, etc., there's no set amount. If you have an athlete in front of you that recently was just playing recreationally and now they've decided, I want to play competitively and I want to make provincials, then you're going to start, okay, well, let's start with where you're at right now and then work the hours and the training up gradually until your body adapts, your body recovers, and then we're going to keep pushing you harder as your body makes these adaptations. So there's no one way of doing it.
That makes sense, I guess. I'm just curious because there's some players, and you know who I'm looking at, that don't take days off, you know. I mean, obviously not players, but their parents think it's not a good idea to take a day off. So what's your stance on that? And is it a good idea to have at least one day off for a kid?
100%. Kids need days off. Yeah. Again, like I mentioned with that recovery, if you're pushing that player too hard, then again their injury risk is going to go up, they're going to burn out, and then you're not doing good for the player. And the body needs recovery, so you'll have a better chance at improving and having the adaptations of. So when you're pushing yourself, your goal is I'm pushing myself to improve my performance and to make those physical adaptations so you can be stronger and better in the future. If you don't give yourself that time to recover, like for example, one day off, then your body can't make those adaptations, and then you're doing more damage than good. So that doesn't mean the whole day you're going to be sitting on the couch and eating potato chips.
Like we do.
Yeah, for example. But yeah, recovery and taking time off is important.
I mean, it should be such a no-brainer, no?
Yeah.
Like, I can't believe we have to talk about it in 2019. No, like it's just like some people just decide like it's absolutely normal. Like I don't get where they're getting this information from. Like, do they care, or like is it like developing mental toughness? But there's so much science behind it. Like, come on, guys.
Yeah, and sometimes, I mean, you'll have your overambitious player as well that just always wants to be on court, and some people just don't know that recovery is just as important as pushing yourself.
It's a hard concept to understand, honestly. Like it is. Like if you're very competitive and you're really aiming for certain results and you're maybe falling a little bit behind and you just want to keep going and going and going, and it's a for myself, for my small little workouts that I'm doing, it's a hard concept to understand. But then at some point, like you mentioned earlier, your body will start telling you, like, you cannot push. Like you notice the decrease in performance, you're like a little bit slower, a little bit sluggish, your reaction is slower. So like that's when you're like, all right, time to go home. Like,
exactly. Yeah. And if anyone is interested, there is actually research that shows that those elite players that took it most easy on that off day, or if they took actually multiple days off after a 13-day heavy training session, the study was particularly for soccer players, they actually had better performance results than those that didn't take enough time off. If you're interested, I could send you the study later on. But
yeah,
there's
for sure.
That's just to say that
is it like a link to a website, or is it in PDF?
I can send you the article.
Because if it's in the link, we'll put it in the video below.
Sure.
Yeah.
Sure, we can do that. But yeah, I'm just mentioning that to say that I'm not just saying recovery is good. It's been shown that you need it. Yeah.
Yeah, makes sense. So let's say a player gets injured. Yeah. So we talked about possible ways of managing the load, recovery. But let's say we get injured. Like it's inevitable, unfortunately, because of all these intrinsic things. Maybe the kid doesn't feel his body as well as a more mature athlete, so doesn't have enough experience in expressing himself or herself. we get injured for whatever reason. We didn't manage that load. We screwed up, you know, as a team.
It happens.
Yeah, it happens. So how do you decide who do you see? Do you see a chiro? Do you see a physio? I know we talked about one of the dinners we went to with Carol the other night, well, like maybe a couple months ago. You were explaining to me the difference between chiro and physio. So how do you know who you should see?
So regarding chiro or physio, education-wise, chiro, physio, okay, there are small differences in Canada. Chiro is a 4-year doctorate program. Physio is a 2-year master's. Both have the ability to diagnose, and both can specialize in sports. So if let's say you have a chiro that decides I want to work in sports, for example, I'm doing the sports sciences residency. I want that to be my specialization. You could just as well have a physio that wants to specialize in sports as well. And I'm not familiar with what kind of specialty programs there might be in physiotherapy for sports. But even if that's not the case, if that physio takes the initiative to take educational courses on the research of sports injuries, and they have a ton of experience, they've worked several sports events, they're familiar with the biomechanics of that sport, then chirophysio can both just as well treat that tennis player in front of you. So it's really who is it that you're seeing? Are they good at what they do? Do they have the credentials? Were they recommended from a reliable source that you trust? And then if you go see them, do you like them? Is your relationship good with them? Do you see progress with the way they're treating? So there isn't really like, this is good, this is bad, or which one should you see, or you can't see the other one at all. At the end of the day, the athlete is the one in front of you that you want to help. And if you have a healthcare team around them, which includes maybe chiro and physio and a medical doctor and a nutritionist or a dietitian and a strength and conditioning coach and the tennis coach, everyone's a team and wants that athlete to get better. So to answer your question, there can be large differences between chiro and physio, but if you have both of them specializing in sport, know the biomechanics of tennis, and have the skill to treat that athlete, then at that point, it doesn't really matter.
Okay, that makes sense. Mm-hmm. My next question is more about, and it's very subtle because it comes down to, again, intrinsic evaluation of the player. And I'm mostly talking about the younger players, like I would say 12 to 14, and depending on their developmental age, like maybe later. Some players, and I think it's becoming, it's not an issue, but it's something that we're dealing with in Canada, probably US for sure. Not sure about Europe, but when a kid is requesting a physio or like a visit to physio or to chiro, when there is no need for that, there is no pain, so they're just I guess they feel like they need to see, but just like suck it up and play, that's what I want to say. But the tricky part is you don't know when they're saying that because they're a little bit soft, mentally, or when they're saying it because it's really something bothering them. So is there a way, like, first of all, what's your take on that? And like, is there a way for a coach to kind of figure it out to, okay, do we continue the practice? Do we have to, this is perfect opportunity, no, let's get tougher? Or do we stop the training or, and make them see? Of course, more mature athletes, you understand, they know what you're talking about, but I'm talking more like with the kids, because sometimes, they feel a little bit of a pinch in their back and their shoulder, and they're like, no, we can still, because as tennis player you have to play through pain sometimes, and I'm not talking through pain and getting more injured, but you're gonna feel uncomfortable, something's gonna be like a little bit hurting, a little bit sore, like you were saying, from if you're playing semis, you already played certain amount of hours. So what's your take on that?
So if the context is training and they feel a little bit of a twinge, again, it's always situation dependent and knowing that athlete. So if you've been the coach of that athlete for a while and you're kind of getting an idea of what they're like, then you can judge. I think you can judge quite well, having known the athlete for many years, where they're leaning to, what's their motivation like do they just hate tennis and want any excuse to get off the court? Well, then you kind of found your answer. But if you know that athlete loves competing and wants to be on court, then I would probably take what they're saying and take it easy, because as that athlete grows older, like let's say if you have a 10-year-old, they don't know whether that's muscle pain or something like is torn or unstable. So it's much tougher to tell in the younger age groups. But if you have like a 14, 15-year-old,
of course,
complaining of pain and it's really bothering them, and you know that athlete just wants to be on court and competing, then at that point, I would say, well, let them rest and let them see that chiro or physio or whoever they're seeing for some treatment, because even if it's not yet like a tear or a real injury, the functional ability of that athlete is very important. And even if you have even a slight discomfort or a trigger point or something in that muscle that's just not letting that muscle contract the way you want it to, like for example, if you have like a trigger point in the shoulder and that maybe alters the activation of the rotator cuff a little bit, then you're going to lose that stability when you're serving or hitting your ground strokes, because your load is coming through the legs, going through the knees to the hip, across the abdominals into that shoulder, and ultimately through the wrist and into the racket. And if you have weakness at any point in that chain, then, and you're going to progressively be playing on that when you know something's already kind of bothering you, well, then you might end up with injury at the end. So if you can catch that early, then yes, go see your healthcare provider to get that sorted, because there are still many things you can do to, again, functionally get that athlete there before it turns into injury.
Yeah. What about when you're coming back from injury? Often I hear players, and even on a professional level, when they're coming back from stress fracture or like a long-lasted injury, they're saying like, oh, I feel something. You know, is it because they haven't used that muscle, that joint in a long time? They're starting to feel a little bit of uncomfortable, a little bit of discomfort, or pain, or is it because they're really feeling it, or like, you know, have you heard that before? Or
so now the context, we're talking professional tennis.
Professional tennis,
okay.
Yes.
So, well, at that perspective, and I definitely don't think it's a joint that they haven't been using. When they're training or competing, they're going to be using the majority of that body to produce that amount of force and continuous force and power in their matches. At that point, it's likely either a repetitive overuse injury or an acute injury, one or the other. Of course, like I mentioned, we have the kinetic chain. The load starts from the feet, works its way up until it leaves the racket. And if you have a weakness in any part of that chain or an injury in any part of that chain, either that area or another is going to compensate and lead to these overuse injuries, or hopefully not, but acute injuries. Either way, both aren't fun to have. But that's just the general thing. There are always your special cases. Maybe they went hiking and tripped on a twig and now they sprained their ankle, but it wasn't really bad at the time, but now they had played 5 hours of tennis and now they're really feeling it. So many factors can come into play with that. If I knew the answer, I would be publishing many risk factor papers. But again, this is just the general, I guess, info on that topic.
Okay, that makes sense. Can you talk a little bit more, perhaps, about rehab in terms of and I know we just spoke about it earlier, that it's very individual and it's hard, and I understand that I'm sometimes asking maybe a question that's it's hard to answer without knowing a specific case, a specific history of that patient. But a player gets injured, and how do we know when can we continue going back to practice? How, like, is there like a number of factors that say, okay, we can try, we can go? I know it's very, very vague, but maybe you can try to.
Let's see. So let's pick the shoulder, for example. Okay. So we tore our shoulder, let's say the supraspinatus. It's one of the rotator cuff muscles. It's our dominant shoulder. We're serving, we need it for the serve, etc. So when can we get back to play? Well, number one, that also depends on the grade of injury. Do we have just like a small tear in that muscle, which would be around grade 1? If it's grade 2, we're like, oh, okay, like I'm pretty uncomfortable, it's painful, but the tendon itself is still intact? Or is it a grade 3 strain where that tendon just tore off of that insertion point and you're super spinatus? You don't even have pain because that muscle isn't even attached anymore. So again, one, depends on the grade. So let's say you have a grade 2, which isn't a full tear, but it's not so easy going either. You're like, okay, I definitely injured it. I need to take time off. How are we going with the rehab? So one, you definitely want to seek treatment for it. So I see shoulder injuries really often in my practice, and the number one thing is treating the surrounding area. So if we have a grade 2 shoulder tear, you're going to be going through treatments like acupuncture, active release therapy, not directly on that muscle, but the surrounding structure, because you want to still have that mobility and as much function as possible, but you're not going to throw them on the tennis court and putting that much load through the shoulder, but you want it functioning as much as you can in that state. And then you're going to follow it up with rehab exercises, but again, you can't just throw them straight into a push-up because they can't even do a basic push-up position, not to mention actually complete the push-up. So then you have to break it down and you have to know, okay, well, where was the break in the chain? So you have the shoulder. Well, okay, for the shoulder to be functioning and for that rotator cuff to be holding that glenohumeral joint, also known as simply the shoulder joint, where the arm bone meets the shoulder in there. Then you need your scapula or your shoulder blade, to be functioning to allow that motion of the shoulder. So you need that shoulder blade to be rotating upwards to allow that shoulder motion. But then you have to be aware of the muscles that attach to that shoulder blade. Anyway, sorry, I'm going into too much detail here. But basically, rehab exercises, you want to know, well, where's our culprit that we need to build up so we have function? Do we have a tight posterior capsule of that shoulder that we have to loosen up, and we have to address that shoulder blade? Let's just start with that for simplicity. So rehab, you want to start as soon as possible. You don't want to just tell them, okay, rest and don't do anything, because just immobility is not a good idea. It's also how frozen shoulder can creep into the picture as well, which we definitely don't want. So then you'll start with simple mobility. I just want your shoulder moving in the acute phases of this
so
shoulder
you still
injury.
Want to, sorry to interrupt, but you still want some activity, obviously not the one that's causing pain, but you still want to keep your joint mobile so that it's not getting, okay.
Yeah. And again, what I'm saying is
Can that cause, sorry again, just another question, can that cause more injury, like in immobility, like if you're not active in that
you definitely want to keep it moving. Again, it's all going to depend on who you have in front of you and maybe what other conditions they might be having, but in general you don't want that immobile. Just like if you break a bone, you'll have it in a cast for a certain period of time until that bone is healed, and then you want to start weight bearing, because the way that bone is healing, it needs load for the bone to lay down in the proper direction, etc., to be stronger. So I mean, maybe that's a poor example, but same thing with the shoulder. You want that moving as soon as possible in a pain-free zone, and then you work your way up. So once we've gone through our scapular mobility exercises, then you'll start lightly strengthening the rotator cuff muscles, but again, all within pain limits. If you have a full tear, you're probably going to be getting surgery to, again, put that tendon back on its insertion point. But that question is hard to answer because, again, it really depends on who's in front of you. But the point is as soon as you can start that rehab program, start it so we can get that athlete back on court as fast as possible. Yeah, it's just going back to, like, it's basically on the highest level, it becomes so important, the time that you're not spending treating, you're back on court, for example. Like we were just talking about that equipment that they have at the Calgary Canadian Sport Institute in Calgary for winter sports, like where they measure exact load you can put on a joint, so that you know when you can push 100% again, so that you don't waste that time. But I think the important concept that you're saying here is that take your time healing your injury. You know, it's not just something that you can rest on. You have to work to get back at it, and it's very, very important not to go too soon, because again, for
parents of young athletes and for athletes more professional, it's so hard, because that's what they do for a living. They're so passionate for the sport. They're so eager to get back to competition. So just take your time, focus on something else. Like I was talking to Carol, she was my first guest on the podcast, and she was going through injury at that time, and she's saying like it's so freaking hard just to treat it, because you're so sick of treating it, but then it forces you to learn that, well, I'm gonna use that time to focus on something else, which was very interesting.
Yeah, exactly. So it's always a fine line there. The mental part is especially difficult when you're in an injury, but trying to keep your positive spirits while in that, and knowing that at some point you'll get out of it and back to function, that's good to have in the back of your mind. But again, you don't want to rush the rehab program. So you definitely want to start the rehab program, but regarding the volume and intensity, again, that's dependent on who you have in front of you. But again, if you need more rehab, then take more rehab. Long term, it's just going to be stronger for later on when you're back in the game anyway.
Yeah. Can you touch a little bit on warm up and the importance of warm up, and for example, like how, and I know it depends on the weather, what type of exercise we're gonna do, and like is it a fitness, is it a match, is it a practice? But let's say, do you have any like comments in general on warm up, like how, like?
Yeah, sure.
Yeah, just if you can talk about it.
Of course. So regarding warm-up, yes, you want to warm up prior to your matches. A traditional tennis warm-up will consist of your jogging, your maybe a couple ladder drills, change of direction drills, and then you'll get into maybe some band exercises for shoulder stuff, which you want to be tennis specific for. You don't always want to do the basic like internal, external rotation. You want to probably bring it overhead because that's mimicking more the serve. And then you'll get into your maybe some shoulder activation exercises against a wall, and then you'll get into your mini tennis and then your ground strokes, etc. And then when you get to serving, again, make sure you're gradually getting to hitting your first serves. You don't want to just like go from the baseline and then grab a ball and just off the bat start hitting first serves. Not the best idea.
Yeah.
And that's also an important part of the warm-up. Some people don't consider that as a warm-up, but just the same way when you're hitting the court, it should also be gradual. And actually, I'm doing research on warm-up. It's my thesis right now in the sports sciences residency.
There you go.
Yeah. And so right now, regarding service speed, so performance and warm-up, it's been found that in healthy subjects, a plyometric warm-up specific to upper extremity shoulder stuff was found to increase the service speed up to 4%. And so that's something you can incorporate into the warm-up, is some plyometric exercises. And then my research is specifically going to be on tennis players with a previous history of shoulder injury that's currently asymptomatic, meaning they have no pain, it's completely healed. If that applies to them as well, if people with a previous history of shoulder injury, if a plyometric warm-up also increases their service speed. So to be continued, I'll let you know what the results are.
Okay, awesome. We'll keep everybody updated. That's awesome.
Sounds good.
What about we have a tennis practice in the morning, or a first practice, whatever, in the morning. We do obviously a full warm-up depending on condition, but like usually 20 minutes to get it going. And then we have 2-hour lunch break, and then we have, or hour and a half, and then we have another tennis practice. How long should the second warm-up be? Is it can it be I guess what I'm trying to say, less time? Is it the same warm-up in terms of the amount of time we spend? What's your take on that?
I'd say it should be the same warm-up. If you exceed, I can't remember exactly what was quoted in the research, but I remember reading about it. I think if you exceed 15 minutes, you should do a completely full
15. Okay,
yeah.
wow.
You should do a completely new warm-up again. But again, I can't remember if that was exactly what or where I read that. But to my knowledge, that is what I remember reading. And in my personal opinion, if it's 2 hours, 100%, I'd be doing the same full-fledged warm-up again.
Okay, so it doesn't matter like whether you're warm or whether it's just okay.
Yeah.
And same goes for, you have like a good example, very specific. You have a singles match. You have 45-minute break between singles and doubles. You would do, because you want to eat. Yeah, you want to do some sort of recovery, like we were saying. And then, so do you still would do like a full warm-up? Sometimes like we have like, what's the word I'm looking for? What's the word? Like a speed warm-up, fast warm-up.
Okay, like a quick warm-up.
Yeah.
So that's
Express
warm-up.
It's getting late.
It's okay. So that, I guess, will come back to active recovery, where you have to watch out for fatigue. So in that scenario, definitely still warm up, but maybe the intensity of your warm up will be a little less, because at this point you need to be considering how fatigued you are and how much your warm up is fatiguing you. So then you manage it like that. And again, if you only have 45 minutes, then maybe not do active recovery and your warm up. Maybe at that point, do an ice bath or a short foam rolling session. Or if you have someone that could give you a sports massage, maybe that. But definitely before your match, you're still doing your warm-up prior to.
What's your take on foam rolling before, like as in the beginning of the warm-up? Is that a good idea? Is that just, what's your take on?
Regarding the research, there's no evidence to show that foam rolling improved performance. So if the athlete feels good foam rolling prior to competition, sure, they can do that. There's no negative effects, but there hasn't been any performance enhancing effects from it.
So it's more like a placebo effect, like, oh, if it makes me, or not just placebo, like if it makes me feel good, I'll do it. If it's just there is no reason to push that on athlete. Okay, awesome. Okay, Dominique, really appreciate you coming out. Just by talking to you and listening, well, mostly listening to you, because like you have a lot things to say. I can tell you have so much passion, and I knew it before, but really getting into details about your career, your profession, just showed me how much you really care and how much you know and how much time you spent learning all this stuff. It's been a big pleasure talking to you. Thanks a lot for coming out.
Thank you so much for having me. It was my pleasure.
Awesome. Thank you. When you're talking, I'm like trying to learn a new language. You know, I'm skipping half of it, and I'm just trying to pick up the words that I know. Oh, grip, I know that word. Or like, you're saying the wrist. Oh, that one as well, I know. Like all these 90s and like... all
sorry.
The bones. No, that's great. The content is fantastic. I'm just saying that like 70% is like me learning Spanish right now.